I'm Hannah.
And I'm Savannah, and this is Pediatric Brain Injury.
Acquired brain injuries are any type of brain injuries that occur after birth. There are two different types, traumatic and non-traumatic. Traumatic brain injuries, or TBIs, are caused by an external force, and they can be an open or closed injury, and oftentimes these injuries are preventable. Some common causes of TBIs are falling, car accidents, sport and recreational injuries, non-accidental traumas, and other causes. Non-traumatic brain injuries are an internal force causing injury to the brain, resulting in pathology or differences in brain function. Some common causes are stroke, brain tumor, drowning, choking, infections, and drug overdose.
Effects of a traumatic brain injury can occur in physical, cognitive, or social-emotional functioning. Some physical effects include vestibular functions, such as dizziness or balance, proprioception, mobility and stability, seizures, muscle tone or spasticity, muscle power and endurance, reflexes, voluntary and involuntary movements, or vision and hearing. Cognitive effects can look like problem solving, memory, attention, judgment, or planning issues. Some social and emotional effects include motivation, initiation, self-control, regulating mood, controlling emotions, or mental health issues.
Treatment and management of TBIs begin within the emergency department, and then the child is oftentimes admitted into the ICU. After the ICU, they start in the acute care wing, and then inpatient, and then outpatient rehab. So the ICU, the child is usually seen by physicians, surgeons, and various therapists. OT treatment usually includes sensory stimulation, basic muscle movements, education for family on future expectations and treatment, and possible environmental adaptations. Acute care is short-term treatment to prevent the effects of bed rest, which often include decreased muscle strength, weight loss, and skin breakdown. OTs can work on muscle movement, tone, adaptive equipment, and further education for families. In inpatient rehab, that is a step down from acute care, but they are still in the hospital. OTs can focus on increased independence, motor skills, cognitive, and behavioral strategies. And then in outpatient rehab, the child is discharged from the hospital, but continues visits to a rehab facility. OTs will promote participation in activities within specific environments, and then community support and resources, compensatory strategies, and education on life after the brain injury.
Occupational therapists can help a child who has had a traumatic brain injury by engaging them in their everyday activities and or occupations again. They can focus on independence that can benefit the child and family. Care for a pediatric brain injury is a lifelong process. Some occupations that are impacted in a child can include education, play, and activities of daily living. OTs can look at these areas for treatment options and focus their practice around occupations. Some preventions that an OT can teach caregivers include wearing seatbelts, using booster seats, wearing a helmet when riding a bike, practicing safe pedestrian behaviors, or increasing awareness about sports injuries. Continuing care is a lifelong process. This can include medication management, therapy services, psychology visits, adaptive equipment, or compensatory strategies. And that is pediatric brain injury. Thanks for watching.